again repeatedly stated here. So because of imbalanced or weakened Agni or less strength of the Agni, the first dhatu gets under-metabolized or not properly formed, and a dushti happens to that rasa. And that dushta rasa, it starts going towards the amashya. So dushtam amashya gadam, and that rasa is called as ama. Dushtam amashya gadam rasam, amam pratakshate. So if somebody asks you what is ama, I know that there's a modern tendency to say ama is toxin, which is absolutely wrong. Ama is not at all toxin. We have seen, that's why I have already placed the concept of annavisha, which has been produced by the fermentation, the shuktatva of the apakwa anna, and which is a serious crisis and which precipitates in an acute presentation, which we have seen before. Whereas ama is a different and a very silent presentation, which is not very easy to even identify within yourself. So ama is not visha, ama is not toxin, ama is saumya, whereas visha is agneya. And ama is paki, can be metabolized, whereas visha is apaki, it cannot be metabolized. So we should not, it's a kind of a theoretic unappropriation that we call most of the time, in most of the translations, ama as toxin. So let us see, first of all, what is ama now? What the text is speaking now. When the ushma, especially we see which ushma of the rasadhatva Agni. Not here, the text is not really speaking about the Jadhara Agni, because we are speaking about the Adya Dhatu Paka, the digestion that is happening in Rasadhatu, which is the Agni that is doing Rasadhatu Paka. It is the Rasadhatva Agni. When the Rasadhatva Agni is low, the Paka of Rasadhatu is not properly happening. When Rasadhatu is not properly metabolizing, what happens? The doshas reaches there suddenly, and it makes dushti in that improperly formed rasa. And the next thing is very important. Then this rasa is being pushed back to the amashya. Dushtam amashya gadam rasa. So this is a very important thing to understand, that if rasa is not properly formed, is not properly metabolized, body will try to push it back towards koshtra. It's like a recycling effort. And this dushta rasa, which reaches amashya, is what is defined as ama. And we cannot really find any parallels about in Western literature what is ama. But we will see there are some parallels and there are parallel observations in latest research material, what we can observe. One of the study that was published is about how portal circulation, the rate of portal circulation, where the end product of digestion is being taken from the digestive, from the medas, and is moved towards the liver, which is being processed there and being further pumped into the inferior vena cava, to the heart. So this, where that drainage is happening, there are studies how the rate of portal circulation is influenced by various factors and indicators of digestion. And they have also seen that there can be a stasis of portal circulation. And in many metabolic disorders, especially we know conditions like esophageal varices and various varices, which is being produced in conditions like liver cirrhosis and various such diseases. You can see how the portal veins are pushing back to the amasya, to the esophagus, to the stomach, to the intestines, how they produce hemorrhoids, how they produce varices in the esophagus or stomach or in the. So when there is a portal vein hypertension and portal stasis, how rasa is being pushed back to stomach. You can see in certain diseases how that leads to certain kind of pathologies. And we will see that ama, the very, very first symptom, the symptoms of ama being explained just before this sutra in Ashtanga Hridaya, as you know, is Srotorodha, Balabhramsha, Gaurava, Anilamudhata, Alasya, Apakti, Nishtiva, Malasanga, Aruji, Klama, Lingam Malanam Samanam, Niramanam Vibhadya is told. So if you look at this, all symptoms, and especially if you look at the very first symptom, Srotorodha, then we will get a bit more insights about how to see this ama. And one important thing, especially when I say we should not call ama as toxin, and ama can be metabolized. And if you metabolize ama, the end product is properly formed rasa and ojas and urja. So that's why we cannot call it as toxin. So we will see how Srotorodha as one of the cardinal feature of ama becomes interesting in various contexts. We know that srotasas are srotamsi khalu parinama apadyamananam dhatunam abhivahini bhavanti ayanardhena is the definition of srotas. So srotasas are channels for carrying dhatus which are undergoing parinama. So it is through the srotasas that one dhatu enters through here, and the Agni, that Dhatwagni is there in that srotas. Once it moves through that srotas, that Dhatwagni keeps metabolizing it, and it comes out through one channel as next dhatu and another channel as mala. So that is the picture of srotas. And in any srotas, the rate of movement of that srotas is directly proportionate to the strength of that dhatva or that agni. I repeat that. So in a channel, so we see pitta, even let us take mahasrotas, a digestive tract. When you have tikshna agni, you have mrudu koshta, you have very easy, fast, soft bowels. This is how it is. When agni is fast, you digest things fast, you expel things fast, you absorb things fast. When agni is manda, things are slow and things doesn't move, and there's a state of obstruction. So this is what is happening at the level of rasavaha srotas in the case of